Welcome back, guys. This is Dr. Somji.
And Dr. Solomon.
Don't have tear trough treatment until you watch this video.
Because we're going to give you options for the tear trough, what to do and what not to do.
Exactly. There's a lot of controversy that we've seen actually on YouTube about not putting filler in the tear trough area. We're going to cover all of these points. We're also going to tell you, hey, look, we're not going to just say don't have filler in this area and then not give you any options, because that's what tends to happen in a lot of these like controversial videos. We're going to actually give you solutions and alternatives if we think that filler is bad in the area.
Yeah, we're not here to scare you. We're not here to discourage you from having a particular treatment. We just want to give you the options, and then you can make an informed decision based on that.
So let's quickly go through what the tear trough is. So it's the under eye hollow. So it's the hollowness that you get from the eye that comes from the middle of the eye over here to probably about halfway down, okay? And if you've got hollow eyes, then if you replace the volume, it'll look lighter, brighter, fresher, and also a little less dark as well.
Yeah, and the hollowness originates from a loss of fat in the area, and that loss of fat can start in childhood years. It can start in your teenage years, but often you see it in your 20s and 30s, and it's usually the first sign of aging. However, it can come on as a result of excessive heat in the area, trauma, illness, anything that can accelerate the breakdown of fat in the area. And as you correctly pointed out, the tear trough actually ends in the midline. It does go slightly below that, but there is another hollowness on the outer part of the eye, which is not the tear trough, and that's a topic for another video.
Yeah, I mean, that's called the palpebral malar groove, but essentially, look, the main thing is if you've got the tear trough, then if you've got hollowness underneath the eyes, it might be worth considering having a treatment to fill that area. Okay. And traditionally, we've been filling that area with dermal filler. So hyaluronic acid dermal filler, which is like a gel-like consistency that's injected underneath the eye, almost as a temporary implant, and it helps lift your own layers up. Some of the problems that have happened over the years, and we're going to talk about it, because I've injected probably more than 5,000 tear troughs across a 10-year period, and I don't necessarily get the same problems that you're seeing on YouTube. People getting a lot of puffiness around the eye area, they're getting a lot of water retention, and they sometimes get lumps and bumps, as well as that kind of like an irregular pattern around there. And how does that happen?
It can happen, worth emphasizing, it can happen. They happen for various reasons. Number one, and the predominant reason that happens is actually the wrong choice of filler. Yeah. The filler that you put under the eye, normally filler is hydrophilic, which means it attracts water, and that's part of how fillers work. They expand.
So if you put it on a petri dish, one drop of hyaluronic acid filler attracts 1,000 times its weight in water. So if you're somebody that wakes up in the morning and has puffy eyes, and you're thinking about getting a tear trough filler with normal fillers, then that probably is not going to be a good option, because all fillers attract water. But there are some fillers that are designed specifically for the tear trough that have a lower, let's say, behavior to attract that water.
We call it hydrophobic.
Hydrophobic fillers, yeah. So, or less chance, because hyaluronic acid itself does always attract water. So one recent one is Restylane Eyelight, which is designed to not attract as much water to that area. There's also tear cell density too. But you have to think about it. Now, I've seen patients that I've treated 10 years ago, and I've done ultrasound images of there, and I've even still seen the filler in that area. So for some reason around the eye area, the filler doesn't break down as much. So it's really important to start low and go slow. So I always inject a small amount of filler in that area at any one time, knowing that it accumulates over time. So you've really got to have, see someone, a practitioner that really has a good relationship with you, that you're going to basically sit there and decide, well, hey, it's been 3 years since my last tear trough treatment. Do I still need it? And it's about saying, well, no, if it's 3 years, let's do it again. No, that's completely wrong. You want to have an assessment, make sure that you're not over-treating the area, and that's really, really important.
Choosing the right amount of filler, and also making sure that you inject the right amount and not too much in the area. But there's also another reason, that's where you inject it.
Well, this is where we all went wrong, and this is the reason why all of these videos came out, because when they first designed fillers for the tear trough area, they thought, oh, the under eye is a very delicate area, let's put a filler that is very soft in there and moldable. And actually, in hindsight, that was wrong, because actually you need a filler that's got a high G prime. So what does G prime mean? It means essentially that it resists deformation in terms of pressure. So like my hand has got a very high G prime, But obviously a piece of paper has got less of a G prime, or a sponge has a high G prime, but it's a bit more flexible.
Yeah.
So you want a filler that actually got a high G prime that you can inject deep, that pushes your own structures up. You inject less of it, and crucially doesn't move over time, because that's where people get problems. The filler somehow comes up through those muscle layers and it comes up to the surface of the skin, and you're like, hey, my doctor injected it deep, but it's now up in the upper layers, and that's where you get the puffiness. That's where you get the problems. So if you're injecting a filler now in the tear trough, it has to be a more rigid filler, and that's where fillers like the Restylane Eyelight are really, really important.
Yeah. Okay, so I come to you and I say, I have had filler in the past and now I want something a bit longer lasting to fill my tear trough. What is my second option to sort of correct or fill my tear trough?
Well, you can definitely do fat transfer in that area as a surgical option, because you're replacing the fat. You can also look at surgery, because if you've got an eye bag, it means that fat pad, that's protective fat pad that's sitting underneath the eye, has moved forward. Okay, and it might have even been displaced downwards, and that's the reason why you get bags. So surgery is always the best option for bags, and even in some tear troughs, repositioning that fat pad with surgery can be an option for you. But there's an emerging injectable, because not everyone wants surgery underneath the eyes, and we've been doing it for probably like the past 2.5 years now. It's called injectable polynucleotides.
Okay. Tell me about polynucleotides. What are they and why would you use them?
So polynucleotides are not a filler. So if you think about what's happening around the tear trough area, the skin is really thin. So polynucleotides increase the amount of collagen that is produced within that area. So as you lose collagen as you get older, the skin gets thinner and the tear trough becomes more apparent. This helps thicken up the dermis, so the deeper layers of the skin, and it also is an antioxidant, so it reduces breakdown of collagen as well. So the skin looks healthier, fine lines and wrinkles look better too. You get more collagen in there, you get more elastin in there, and it's a softer option for tear troughs without the complications that you get with hyaluronic acid fillers.
There is another alternative to thicken the skin around the tear trough area, and something that actually you've been doing for many years.
Yeah, so injectable Sculptra. So it's not available on license to inject around the eye area, but in more dilute. So with Sculptra, it comes as a powder. It's a collagen stimulator that essentially stimulates your body to produce more collagen. Yeah. So again, you can get increase in skin thickness, and we can use it in other areas of the face, and you can sometimes get increase in volumes. You might see it on things like TikTok with people injecting into bums to get bigger bums. In Sculptra, you can dilute that more for the under eye area in a delicate setting. They do it a lot in Korea and Asia, not so much in Europe and North America, but it's injected underneath the eye area, and it just stimulates a little bit of collagen improvement in volume, and it's also an option for the tear trough. Personally, in my practice, I don't really do it so much, but it's something that's really, really popular in Asia. I prefer polynucleotides because they're a lot safer. And you can then do 2 or 3 treatments of that, and that probably would equal a 1 tear trough treatment, and then you can maintain polynucleotides once every 9 to 12 months.
So in summary, we have various methods by which we can fill the volume in the tear trough region where we've lost some fat. We can fill it with hyaluronic acid fillers. Yeah. We can use fat, we can do a fat transfer. You can surgically also tighten the area. And another non-surgical older treatment is the Sculptra treatment, which again might be off license, but certainly in a dilute format can work very, very well. Yeah, so I mean, look, the main thing is to get an assessment with a doctor to make sure that everything's okay. You might be a very good candidate for traditional fillers in the tear trough area. I really wouldn't worry about a lot of clickbait videos where people are saying that, filler is bad, because, I've personally done it for more than a decade and my patients are absolutely fine. Every now and again, because of the softer fillers used and poor patient selections, you can have problems. But one thing you need to remember with filler is that it is reversible, so you can inject an enzyme to remove it. So it's like saying, I'm going to have a breast implant and I never want to remove it or exchange it. At some point, when you put something in the skin as an implant, you may have to remove it and redo it. And that's the actual kind of like ethos that you need within the tear trough area. But having said that, with more than a decade's worth of experience and emerging new technologies like polynucleotides, if you want to really treat that tear trough area, there are now other options
so you don't have those small incidents of side effects. And it's worth mentioning, and there's thousands of patients that are treated, you're talking about less than 0.05% of individuals that have problems. And 95 to 100% of those are actually reversible, and you can do something about it.
I hope that video was helpful, and we aim to produce more videos on the tear trough and talking about sort of rejuvenation around the eye. Don't forget to hit like and subscribe and comment on any other topics you might want us to produce, and we'll see you next time.